So, hello, Dr. Erskine, and thank you for accepting my invitation for today.
Hello, Erskine. It's a pleasure to be here with you.
Thank you. I'm so excited for this conversation. Yeah.
Me too.
I would like to start from the very basics of your approach, the philosophy behind the approach. And um, I recently read your article about the development of integrative psychotherapy, and I realized you mentioned all the philosophers that actually had an impact on your theory, and you chose to actually pick them between all those philosophies that as the very basics of it. And I'm so interested to know because you integrate TA, Gestalt, object relations, psychoanalysis, and I want to know where is the thread, the philosophical thread that connects all of these together.
I think that philosophical thread is really in the writings of some of the German philosophers of the
Hmm.
early 20th century. Um, Martin Heidegger and Martin Buber, particularly, and Paul Tillich and Herzl, with the concept of phenomenology about the inner truth of a person, a truth that is out of one's own experience and how people make meaning and sense out of their life. Um, it leads us then to a non-pathological perspective of people's emotional difficulties. But those emotional difficulties are how that person in the process of growing up learn to cope and understand and make sense out of their own world. So, one of the important philosophical principles is that psychopathology as itself does not exist. What we call psychopathology is the person's reactions to relational conflicts.
Mm. Mm. So that then leads me to my second question, which is about the line between diagnosis and treatment planning, and to accept and value and respect the way of being that the person has.
That's a very interesting interplay. I just recently wrote a book on the treatment of borderline clients um, called Early Affect Confusion, where I
Yes.
tried to write it from a non-pathological perspective
Yeah.
for a group of people who are particularly troubled by their life. Um, but to look at it in terms of child development and what
Mm.
are the needs of children at various developmental ages, and what happens when those needs are disrupted, when they're continually disrupted, and how does the child adapt themselves, or even more than adaptation, uh, they really change themselves, they accommodate to
Yeah.
what their environment is demanding. And so I look at it from a developmental perspective, not so much a diagnostic one. And I do my treatment planning because I'm always thinking, what are the relational needs of a child at that particular developmental level?
Mm. Mhm. So now I remember that in your article you wrote about when you moved away from a confrontational technique-based approach to more a relational attuned presence. And somewhere you mentioned, I think the confrontational method was useful for my borderline clients. And that leads me to think well, is it more the confrontation of the bad that is going to be a healing or more attuning to the relational needs and the shame underneath that aggression that is happening?
I think the latter.
The,
Let me back up and give you a bit of history of it first.
yes.
In my early training as a client-centered therapist, I was very much in the Carl Rogers tradition of focusing on the unconditional positive regard of the person and the empathy. Although with many borderline clients, that just in some ways exacerbated their situation. They became much more helpless in that situation. And I was often impressed by the confrontation Fritz Perls did. And when I was active in TA in the early 1970s, confrontation was the most common method. And it was useful with some of my borderline clients when I'm talking about their binge drinking of alcohol or their use of drugs or how they abused their partner verbally and then felt hurt when their partner wasn't cuddly and affectionate with them. And so the confrontation was about to get them to really think about the effects of their behavior. But with many other clients, particularly as I worked with people who were more abused as children or victims of sexual abuse or other kinds of clients, I found that the confrontation was not as effective as a very gentle, respectful inquiry into their own phenomenological process. Do I still use confrontation? Yeah, when it's appropriate. But I think confrontation does not work unless the client has the experience. This therapist is invested in my welfare. If the client doesn't already have that experience, what the therapist then says in a confrontive way is only experienced as another criticism of who they are.
So in a way, they don't feel safe in a relationship. And you want to first provide a place that they can feel safe. And
For
then,
all of us, man, for all of us, security in relationship is the most important relational need that we have. To be in the presence of somebody who's not going to humiliate us, who's not going to criticize us and put us down, who's not going to hurt us in some way. We all need that throughout our lifetime.
And then on that basis, you can provide confrontation too. But first, you need to establish that.
Sometimes I even ask for permission. You know, I've got something I want to say to you, and you're probably not going to like it. And I don't know if I should say it or not. What do you think? And then they say, oh, yeah, go ahead, tell me. But in doing that, I have created a preamble. I have given them choice.
Yeah.
And I have given them some forewarning that they may not like it or that it might be uncomfortable. And generally, they have now invited me into their private space.
Yeah. So allowed you.
Yeah.
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 So it has a role, but I know my friends in more analytic approaches, they would prefer more of like confronting the badness, the destructiveness, especially the approaches that prefer the philosophies of death drive, I would say. But I know it's when you moved away from that philosophy to a more self-psychology code based, I'm actually I was very confused between these two, as a person learning methods and seeing the difference of what I prefer and what some of my friends prefer. And I still think sometimes which one works. Sometimes both work, but sometimes.
I've just finished rereading James Masterson's book on the treatment of narcissism and borderlines.
Mm. Yeah.
And he's advocating confrontation
Yeah.
in treating particularly narcissism, whereas Kohut recommends empathy
Exactly.
as the way. And I realized that both of them are talking about some of their clients, and they're
Mm.
probably both reflecting their own way of being. They're reflecting their own story. And I have been fortunate enough to know a number of people who are authors and well known in this field. And so
Mm.
often I think they're all telling their own version of the story.
Mm.
You know, so that I'm skeptical when people have a strong view on something.
Yeah. So would you say that it was also true for yourself? It was the reason that you tend to more towards this philosophy was on the basis of your own history?
It was certainly how I was raised,
Mm.
with a very respectful and gentle mother who was often gave me choice and the freedom to make a lot of my own decisions. Um, I gravitated to client-centered therapy because I think that fit with who I was already. I got very intrigued by Gestalt therapy and the wild TA of the 1970s. Uh, the metaphor of that time was the cowboy therapist who rode
Yeah.
into a town and he took out his lasso and he tied up the games and scripts and he had a shootout
Mm.
of the rackets at the OK Corral and he rode off into the
Yeah.
sunset.
Yeah.
Done with a lot of confrontation.
Mm.
All right. And I was intrigued and fascinated by that, but it didn't fit with how I was comfortable working and
Mm.
didn't fit what some of my clients needed. Did they
Mm.
adapt to what I did? I think so. Was it healing? Maybe not. Yeah.
Mm. Mm.
So I think mostly how I practice now is a result of the training of me that my clients have done. The
Mhm.
feedback I've got from my clients about what works and what doesn't work. So when I'm writing a book, even though it's about theory and methods, it is probably quite autobiographical.
Yeah.
Not just my childhood autobiography, but my autobiography as a professional with now over 60 years of experience.
Mm. So was it like you could then later recognize and choose with which clients you can work and which clients need something else?
I don't work well with alcoholics. I'm not patient with them. I don't work well with drug addicts because alcoholics and drug addicts often lie.
Mm.
Um, and I have a hard time with liars.
Mm.
Um, although I just published an article or a chapter in a book that's coming out this week called Essays in Integrative Psychotherapy on
Yes.
my work with a client named Wayne. And Wayne was an alcoholic, but he agreed to go to Alcoholics Anonymous. So I
Mm.
had Alcoholics Anonymous as my co-therapist.
Okay. Yeah.
Then I could work with him. because they took care of the alcohol problems and I could deal with the psychological issues. I think as I've gotten older, I attracted more narcissistic patients. In my last 10 years in New York, I had several
And
clearly
and you
narcissistic clients.
you were already famous by that time.
That's why they came.
Yeah. Anyway.
Before, when I wasn't famous, I got the borderlines.
Yes.
I got the sexually abused clients. I got the people whose marriages were in trouble.
Mm.
But as I got well known in the New York area, I started getting more and more narcissistic clients. Yeah. And I enjoy working with them.
Mm. So how about with narcissistic style? Is it also the same that some of them you think might need more of that confrontational and some of them more the attuned presence?
The answer is yes to both parts of that question. But that confrontation's got to come much, much later if I'm going to use it at all. I would
Mm.
rather spend time doing a whole series of phenomenological inquiries so that they come and tell me what they need to change rather than for me to introduce it. Is it part of the whole narcissistic dynamic, whether it's narcissistic style or pattern or disorder?
Yeah, you put it
Is
on the spectrum, right?
yeah, yeah. Is that one of the script beliefs is that no one is really there for me.
Yeah.
And I'm not lovable just as I am. Just as I am. All right. So they have to do things to make themselves bigger and bigger and more beautiful and smarter and more accomplished
Mm.
and more powerful.
Yeah.
But the other belief is no one's really there for me. So it takes a tremendous amount of time to establish with that client that I am really here for you, present with you and for you. And I'm not going to be used by you, but I'm going to be here with you. And that takes a long time to build that empathetic relationship. And it requires moving into the mind of the client. This is what Kohut referred to as vicarious introspection. So that's why I shared those two script beliefs. I'm not lovable just as I am. And no one is there for me. So they're really all alone. There's an emptiness. And I think you have to address that before you start addressing the behaviors.
And how would you describe your therapeutic stance generally with these kind of people? It's like more of, is it more close or is it more distant or is it more, you would say, serious? Because you might be attacked, you might be facing destructiveness sometimes, or what?
Certainly, I must be different with every client. But I think if somebody were to watch, it'd probably see that I would be considered close, that I would be building intimacy where possible in every session, that I would be honest and direct, but I might be circumspect in when I say it. And I'm probably careful about how I say it so that they don't experience it as an attack, or they experience it as I'm on their team. And so it's probably going to be different with each person. And there are some clients I may sit there and just let them do their thing for a while waiting
Mm.
for that right opportunity when they're invested in what's my opinion.
Okay.
Yeah.
Yeah. So you stay a little bit further until they really become interested in you.
What's some?
With
What's some?
some, with some.
Yeah. 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 I don't think I can generalize to the
Yeah.
whole, to
Yeah.
all my clients. Yeah.
Mm, mm, mm. And as
Now,
you,
where I do use confrontation is with people who are not particularly narcissistic. Maybe they would, under pressure, have a narcissistic style. Um, but almost all people will have what I call narcissistic moments
mm,
where they're, in the store and they push and they make themselves at the head of the line and disregard
mm,
other people. All right, that's a narcissistic moment. At that
mm,
moment, it's all about themselves, and there's
yeah.
no capacity to be sensitive to what other people need. Um, and when clients tell me that story, I help them understand what was going on with you that minute that you disregarded somebody else and it was all about you. Um, or some people will come in and tell me about narcissistic incidences um, of a man who constantly was getting into arguments with his neighbors about where they put the garbage. And he was imagining, even long before he took his garbage out, throwing his garbage on the other man's steps. Um,
Mm,
that's a narcissistic incident. It's going on in his mind to
mm,
show that he's superior to the other guy.
mm,
Um, and that I kept coming back to and say, now what was happening with you? And what is this compensation for? What was missing in your life that you have this kind of fantasy?
mm, mm.
That's a type of confrontation.
Yeah. Mm. And as you mentioned about cowboy therapist, I was thinking of when I was trained in clinical hypnosis and
Mm-hmm.
um, ego state therapy in a way that is making regression, changing something like
In 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 the
redecision
style of
work.
John Watkins.
Exactly, exactly.
Okay. Yeah.
In their style, yeah, I'm trained in ego state therapy, and
John
I
Watkins and I became good friends in his later years.
really,
Yeah. I hired him once to be the keynote speaker at a TA conference.
oh
It was
wow, I didn't know that.
compare the similarities and the differences between his ego state approach and TA. Yeah.
Yes, I think the work is very similar to redecision work sometimes.
He was more hypnotic. He used much more classical hypnosis. Uh,
Yeah,
but similar in terms of oh, they're focusing on psychological reorganization.
yes.
All right. And that's what I wrote about in the book Integrative Psychotherapy in Action, about facilitating the regression for the purpose of reorganizing early life experiences.
Mhm. And his approach was more focused, mostly focused on dissociation and dissociative experiences.
Yes.
And
Yeah.
so he uses hypnosis as a vehicle to make the dissociation and then access different parts.
Hmm.
So I was trained in, and I'm trained in that style of working to
Okay.
facilitate the integration between the parts. So
Hmm.
it's through dialogue with each part in
Yep.
hypnosis. Yeah.
Yep.
And and then I realized in your approach, especially when you mention dissociation, you emphasize even more on non-technical or not technique-based, more the presence and sensitivity of moment-to-moment experience rather than a technique that facilitates that. Am I right in that understanding?
Probably. I'd like to see a transcript of the two works side by side.
Yeah.
But I think you captured well. Yeah. I think a good example. So much depends on the client, and it depends on our relationship and how long I've known the person and what risk I can take with them. I learned a lot about doing deep regressive work during the hippie era when I was I lived on the university campus. On Friday and Saturday nights, people would come to me freaking out on LSD or psilocybin or mescaline,
Yes.
and they would be having a bad trip. And if I could stay with them long enough, and I could create enough of an empathetic bond, pretty soon their bad trip would actually be the reliving of some traumatic experience they had had much younger in life.
And that is
And
exactly, I think, what nowadays hypnotherapists with facilitation of some of these trips, I would say, they would do as methods of
yeah,
working with people. Yeah, it's
yeah,
becoming.
but that's
Now,
what I was doing in the late 60s.
yeah, but now it's becoming more popular. Yeah.
Yeah, yeah. So I learned a lot about the importance of regression. But at the same time, I was very much interested in Arthur Janoff's primal therapy,
Mm.
which he was interested in facilitating people's regression. Except he was sort of on one track. He believed that there was the primal birth trauma, and that you had
Mm.
to get all the way back to the birth trauma, and you had to
Yeah.
scream for help in the birth trauma. I found that many of my clients went regressed, but not so far back. There were many other traumas about father beating them, mother dropping them, more than likely being put in the room, turned off the light, and left to cry all night long.
Mm.
And that's what many of my patients regress to.
Mm.
If
Mm.
I could create a supportive and protective environment.
Yeah, so they could regress to different developmental ages or stages.
Yeah, yeah. And that's happening all the time, particularly in therapy. When we create that very protective cocoon of our therapy room and our relationship, that facilitates some regression to what is unfinished and
Well,
longing
mm.
to be finished.
But that's exactly what I mean. As I, I mean, when I read your case studies, it's like it's happening naturally, very naturally, sometimes without you putting a technique on on the table and actually working with a certain protocol to access and reach the trauma. But it happens naturally as you do the inquiry and attunement. And
If you do the phenomenological inquiry consistently and with some historical inquiry, you're going to facilitate regression if regression is necessary. Certainly, you're going to facilitate remembering.
yeah.
And you might even facilitate reliving. So it sounds like we've been on the same track.
So I think my understanding somehow was correct, that you shifted from that technique-based methods more towards this non-directive way of being so that it happens more naturally.
In the book Beyond Empathy, I tried to write about presence, a
Yes.
concept that I find so difficult to write about. I can feel it, I can sense it, but I don't have the language to describe it. And it's so much then about what we do. It's about being really present, being with and for that client, and communicating that without speaking about it, communicating it by how we look in their eyes, how we are in their presence, which creates that sense of security that people can drop their facade
Yeah.
and allow themselves to experience what is inside needing attention.
Mm. And especially in your book, the healing relationship, that you have the videos, that
Yeah.
moment you analyzed it moment by moment, the words, the look, the tone of the voice, and everything.
Yeah. But that's my fault. Excuse me. I thought I had turned it off.
Okay.
Okay. Now it's off. I'll put it on silent.
Okay. So now that you spoke about presence, what's very interesting to know, for me to ask from you is now your idea about the new methods of psychotherapy facilitated by artificial intelligence. There are many, many apps. There are many tools that people access all the time. And some of them are claimed to be therapies on the phone or with bots, robots, but certainly what's missing is the presence, is the contact. But I'm afraid what my experience is now these days is that some of my clients who I thought we are on the way of making the contact and and they are the ones who need that the most. They left therapy and started connecting with AI. And because it's giving them much more cognitive understanding than I could give in a session. And they would be, for them all the time, much cheaper than therapy. No need to invest in that way. So easy to use. And this shift is like it's happening. I want to know your perspective for future of psychotherapy. How would it?
Frankly, I know nothing about it. I've never seen any of those programs. I
Wow.
had one experience with AI. My grandson was here telling me about it, and he looked me up on AI and said, he put in my name and said, what has he said about transference? And out came 7 pages. About 90% of it was accurate.
Yeah.
10% I hadn't said. It wasn't my idea.
Yeah.
It was somebody else's mixed in with it. But that's the only experience I have with artificial intelligence. I've stayed away from it. Now, most journals, if you're publishing in the book I just published, I had to sign a paper that none of it was generated by AI. So I don't know about what this possible AI psychotherapy could do. What I know is it would probably provide some easy panacea. You know what I mean by panacea? A quick
No.
fix. A quick
Yeah.
fix with
Yes.
an intellectual understanding and like putting a good bandage over a wound, but it needs antibiotics.
Mm.
The wound might heal on the top, but you can have a systemic infection underneath. Um, I'm a firm believer in the healing power of relationship. And you
Yeah.
asked earlier about my philosophy, that healing occurs through a contactful therapeutic relationship. And that's an underlying philosophical position of how I do all my therapeutic interactions. It's about really being present and with the person in that committed way and bringing to them skills and commitment to their person's well-being.
Mm.
And I don't think we're going to get that ever from AI. Can they say the words? Can we teach a machine to parrot us? Certainly. And
Yeah.
they might even do a better job because they won't stumble around the way I do.
They
They'll,
will make
they'll,
so many mistakes.
yeah, yeah, yeah. And yet it's out of those mistakes, particularly those important errors in attunement, those errors in empathy, those errors in judgment, that we have an opportunity to identify with the client what makes that a mistake and what
Mm.
does that mistake mean to you
Mhm.
and what would you like me to do differently. And I prefer to identify those mistakes even before the client does, but certainly it's important that we identify them, talk about them, maybe even try to correct them. Now I say maybe because often it's too late. I can't correct it. I've already done it.
Yeah.
Um, or I could make a commitment to be mindful and avoid making that same error again.
Mm.
But I think these errors are inevitable because we're two different people and they're necessary as part of the therapy.
Mm.
And I've apologized to some clients for having made mistakes. And I've had them come back and say, no teacher has ever admitted to doing wrong. No teacher has ever apologized to me, or my father would never have done that.
Mm.
And
Mm.
that in itself becomes healing.
Yeah. Mm. Mm. So the contact, the presence, which are the very basics, you wouldn't
Yeah,
think ever be replaced by any machine or any bot or any.
I don't think so. I think what Janet Morrison and I have written in the book Beyond Empathy, I think is what is classically psychotherapy that I have learned from client-centered, from psychoanalysis, from TA, from Gestalt,
Yeah.
and it's my own integration, and that's what I live with.
And exactly as you say, uh, it's difficult to write about presence and it's difficult to put it into words. I think it's the difficulty that when someone really connects with AI or these programs, they actually don't know what they're missing. And it's so difficult to convince it's or to suggest something because that's something experiential.
What came to mind just when you said it is the difference between a mother holding a baby to her breast and nursing the baby, and the other mother who prepares a bottle, takes it to the crib, has a device that props up the bottle, and the
Mm,
mother walks away. In
mm,
both cases, the baby is getting food.
yeah.
But what is missing with the baby who has to hold the bottle herself?
Mm,
And that was the analogy that just came to my mind when you talked about
yeah.
AI generated psychotherapy.
Yeah.
It's like propping up the baby with a bottle instead of cuddling the baby while nursing.
Yeah. And that's realization of what was missing. often comes very long in therapy, very long after therapy. I would say maybe after 1 year or maybe after 2 years, when the attachment is established with the therapist. And then you know what was not there before.
Yeah, yeah. And then you have to be very carefully watching how does the story unfold, how it gets enacted in their behavior, how it is stimulated, expressed in their affect, how the archaic story is told in their body gesture and their movement and their tightening of muscles, or even how it's engendered in the therapist. What do I feel towards this client? Am I cold towards them? Am I very warm? Do I want to scoop them up and hold them in my arms? Do I feel like I want to teach them something? No, why am I having this emotional reaction now? And how was that part of a shared, co-constructed story?
So now we're talking about projective identification as well as the countertransference that's from the side of therapist.
It depends on which definition of projective identification you're using.
I like to
certainly
know your
wouldn't.
definition. Yeah.
Okay. Then I would use it the way Fairbairn changed it from Melanie Klein, because Melanie Klein used it in a very unique way about the baby hating his mother.
Yeah.
Fairbairn used it with projection and identification. That the person projected out something and the therapist identified with what the projection is. Now, if you think in one of the things I like about TA and the ego state diagram is it is a wonderful little diagram that I can use. You show interjection of the parent ego state, for example. And then the person excludes that from awareness. They're unaware of their own parent ego state. They project it out and they get other people in their lives then to identify it with it and treat them just the way their parents did.
And not everybody identifies, so there must be something in the other person to identify with that, right?
A sensitivity or an insensitivity, one of the two. The other possibility is that they deny what happened in their own child. And I found this often with some therapists, particularly therapists who want to nurture and rescue every client, is that they deny the child in them needing that kind of gentle, caring treatment. They project it out onto their client, and then they treat their client as though the client is helpless.
So it's called infantilization of the...
That's right. That's right. Out of their own need.
Yeah. Yeah, these are the things that I only experienced in supervision. And usually my therapy and supervision are at the same day. So right after supervision, sometimes I need to go to therapy because I explore what was happening, what's from my side, what was from my own identification and why.
I was fortunate for a number of years. I had my psychoanalysis right in the middle of my long work day. So I would work every day until 1 o'clock. Then I'd walk across the park, do my psychoanalysis for an hour, and I'd walk back and finish another 5 hours of my day. But often I was talking about my reaction to the clients I had seen that morning, or my reaction about the clients that I'm about to see in the afternoon. So that there was not much difference between supervision and psychotherapy.
That they're so connected.
That's right. Which bothers me when you have some professionals want to separate psychotherapy and supervision. I
Mm.
think good supervision can sometimes include psychotherapy because there's issues that'll come up in supervision that
Mm.
often don't come up in individual psychotherapy.
Yeah, my experience was sometimes I or my supervisor inquiries into some aspects of my life, but then I will need the to bring that in therapy for the involvement and the attunement of the therapist. So the inquiry is already happened in supervision. So
As long as you can make that transition.
yeah, so she might choose not to go towards that more deeper, but she identifies and gives me the clue for the next session.
Mm-hmm. Mm-hmm. Yeah,
Yeah.
that's one of several ways of working. Yeah, yeah.
So my last question would be how has it all changed for you throughout the years with the world that's changing around us now?
Well, the biggest change is I'm now retired and I'm not seeing patients. I I do I do see patients some mornings of the week, but I'm
mm,
not haven't taken anybody new for a number of years now,
mm,
and I've been doing the writing uh, that I haven't been able to do most of my life when I had a young family at home and had a full practice and a full training schedule.
mm.
So I've finally been able to publish things that have sat in the back of my mind for a long time. Uh,
That's
so
good for us. That's
my life is changed, and I'm still traveling. I'm about to uh, go to Europe for 2 months, where I'm teaching in Spain, France, England, Turkey, and Poland.
Mm,
Um, so I'm doing a number of 5-day workshops and a number of 3-day supervision groups in the
mm.
various countries. Um, that's stimulating and tiring. Um,
Yeah, but so you
and then I do some programs online where I'm teaching concepts or I'm doing supervision group online in the wintertime.
so you're very much involved in all of this. So you're you're not retired.
I'm retired from my clinical practice because I don't think I'm in a position to take on any long-term clients now.
Mm,
Um, I
yeah.
made a commitment when I moved here. This little office that you see, I
Mm,
designed this to see clients when I first moved here. And I saw
mm.
one client and she said, "Oh, you're too expensive. I'm not coming back." And I was happy. And I said, "Okay, now I have a writing studio."
Yeah, and since then you didn't accept anyone new.
No, no, no.
Okay.
Uh, but what's changed in the field? Certainly the people I interact with are doing an in-depth, high quality of therapy that touches my heart. I'm going to be doing a number of supervision groups coming up. And as people talk about their clients and the work they're doing, there
Mhm,
are a lot of people out there now who are part of the International Integrative Psychotherapy Association who are
mhm,
doing really fine quality work.
mhm.
Um, like Elif, who you mentioned, you
Yeah,
correspond with. I've watched her just mature as a professional uh, and the depth of work she's able to do with her clients.
yeah. Mm. And I mean, you have seen different movements and decades of psychotherapy. I mean, do you see any change happening in the field generally? I mean, there is more now, more short-term therapies are now becoming again more popular. Sometimes trauma therapies that are more structured, more protocol based.
Certainly here in Vancouver, EMDR is very popular.
Yeah,
Throughout
exactly.
many places in Europe is brain spotting.
Yes.
Um, they're short, intensive techniques that take somebody into an experience. They do
Yeah.
something to reorganize, and that's the end.
Yeah.
Um, I've been instrumental here in Vancouver in getting a number of people who are EMDR specialists to realize that the relationship has to be there on both ends. You need to spend a good deal of time building the relationship with someone.
Mm,
Then, if you do the EMDR, it's more effective, and you have to be around to continue the relationship afterward.
mm,
Um, but there's always going to be people who are looking for short, quick, easy forms of psychotherapy.
yeah.
And some people say it's been really important in their life, that
Mm,
they've changed.
mm,
Uh, But it's not how I do therapy.
mm.
Uh,
Yeah, I'm personally also trained in EMDR and hypnosis and ego state therapy. So in the way Watkins do. And personally, I'm very curious how you help those therapists like EMDR therapists to put them into the frame of relationship-based, contact-based therapy when that's so much protocol-based and like a guided.
that's what that's one of the reasons I wrote the book, The Art and Science of Relationship,
Yeah.
to try to influence other psychotherapists about using a much longer, simpler, but longer relational approach along with their other methods. My intent is not to criticize the use of brain spotting or EMDR or things like that, but to say they have to be used as a technique within the therapeutic relationship. And by that, by the therapeutic relationship, I also think about the importance of the therapist constantly be thinking developmentally
Mm,
about, what would be normal? What does a child need at each developmental age? And to
mm,
continually be inquiring in a developmental way.
mm. So then the therapist chooses if it's appropriate now to use this technique with this developmental stage of person that I'm working on.
That's right. Yeah.
Yeah.
So it's not, the problem isn't in the techniques. The problem is when and how they are used. And
Mm,
are they used within a healing relationship?
yeah. Hmm. I think I got all my answers for today. So I
Well,
would like
thank
to,
you.
yeah, thank you. Yeah, it was
This
a,
has been lovely.
yeah, thank you so much.
Okay, let's
Yeah,
do it again sometime.
yeah, I would love to.
Okay, goodbye for now.
Thank you so much. Goodbye.